For more on the Ebola outbreak, we're joined by Dr. William Schaffner. He's an infectious disease specialist at Vanderbilt Medical Center in Nashville. Dr. Schaffner, good morning.
Good morning, Anthony.
A lot of people are understandably nervous about Ebola patients being brought into this country. How concerned should we be, Dr. Schaffner?
Actually, I'd like to be very reassuring. The average person doesn't need to be anxious at all. This is a virus that we can contain very, very securely. We know how to do that. Emory is excellent at doing this. The CDC is watching over it, and we infectious disease doctors who know the most, we're not concerned.
I think one of the fears that people really have is when we hear words like there are no cures, there's only experimental protocols. So what exactly will happen aside from them really being isolated from the world once they arrive for treatment?
Actually, the treatment is very important, Vanessa, because although we can't treat the virus itself, we are expert at providing good supportive care. We can watch to see all that the organs are functioning well, that the patient's metabolic status is good, and this will help the body recover from the virus, will give the patients the best chance to survive this virus.
Dr. Schaffner, we're talking about the worst Ebola outbreak in history. Why has it been spreading so quickly?
It's been spreading quickly because previous Ebola outbreaks were in isolated rural villages where it could be contained. This has gotten into population centers where people move around. There are also a lot of rumors that have swirled around, so some of the local people are now not accepting advice and care from people coming in. And then also, this sounds a little ghoulish, but funeral practices are very important. Out of respect to the dead in those cultures, it's very important that people be washed very thoroughly. And that's done by family and friends. That's exactly how people then acquire the infection from the dead person. And that has not been able to be interrupted. And so we have to work on a number of things in order to try to curtail this outbreak. And I love the new attention that the World Health Organization is giving and that the CDC is sending people there to assist.
All right. Dr. William Schaffner in Nashville this morning. Thanks so much for being with us.